For decades, we have been told that there is a single universal gold standard for a healthy heart. If you walk into almost any doctor's office in the United States, you will likely see a poster on the wall stating that 120 over 80 is the perfect blood pressure. We are taught to look at those numbers as a definitive pass or fail grade for our cardiovascular health. If your numbers are higher, you are told you are at risk. If they are lower, you are considered safe. But if you are over the age of 50, 60, or 70, is that classic rule of 120 over 80 actually the right target for your specific body? The real truth is far more nuanced, and rigid adherence to a single number might not be doing you the favors you think it is. In fact, as science has advanced, researchers and cardiologists have begun to realize that the ideal blood pressure for an older adult is rarely a one-size-fits-all answer. The perfect number for you depends heavily on your age, your unique medical history, your daily activity level, and how your body tolerates medication. If you have been stressing over a reading that creeps up into the 130s, or if you have been feeling dizzy and lightheaded while trying to force your numbers down to 120, you may have been operating under an outdated assumption. Understanding how blood pressure requirements change as we age is one of the most critical steps you can take to protect your longevity, your brain health, and your daily quality of life. To truly understand what your blood pressure should be, we first have to look at what happens inside the human body as the decades pass. Our blood vessels are not static, rigid pipes. When we are young, our arteries are remarkably flexible, elastic, and resilient. They expand and contract easily with every single heartbeat, absorbing the pressure of the blood being pumped from the heart and smoothly distributing it throughout the body. However, as we age, a natural biological process occurs. The walls of our major arteries gradually lose their elasticity. This is a process known as vascular stiffening, and it happens to some degree to everyone, regardless of how well we eat or how much we exercise. Think of it like an old rubber garden hose that has been left out in the sun for years. Over time, that hose becomes less pliable and stiffer. When you turn on the water faucet, the stiff hose cannot expand to accommodate the water flow, so the pressure inside the hose naturally increases. In the human body, this loss of arterial elasticity means that when the heart contracts and pushes blood into the circulatory system, the stiffened arteries cannot stretch to absorb the force. Consequently, the pressure rises, and this is precisely why many older adults notice their top blood pressure number steadily climbing over time, even if they have had normal or low blood pressure their entire lives. It is a reflection of structural changes within the blood vessels themselves. To make sense of how these age-related changes affect your health, it helps to understand exactly what those two numbers on the monitor are measuring. The top number is your systolic pressure. This measures the maximum force exerted against your artery walls at the exact moment your heart contracts and pumps blood out to the rest of your body. The bottom number is your diastolic pressure. This measures the pressure in your arteries when your heart is at rest between beats, refilling with blood. When you look at a standard reading, like 120 over 80, you are looking at a snapshot of this continuous cycle of work and rest. A reading of 130 over 80 indicates that the heart is working slightly harder to push blood through the vessels during a contraction, though the resting pressure remains stable. A reading of 140 over 90 has traditionally been the threshold where clinical hypertension begins. But here is the interesting catch for older adults. Because of vascular stiffening, it is very common for the top number, the systolic pressure, to rise, while the bottom number, the diastolic pressure, stays exactly the same or even drops. This creates a very specific condition where you might have a high top number but a perfectly normal or even low bottom number. This pattern changes how physicians must evaluate your cardiovascular health because focusing solely on lowering the top number might inadvertently push the bottom number too low. This biological reality has sparked an intense, ongoing discussion among medical professionals regarding what the actual guidelines should be for older patients. Today, major health organizations often have slightly different perspectives on what target numbers doctors should aim for. For instance, some intensive guidelines suggest that almost all adults, including those over 65, should strive to keep their blood pressure below 130/80 if they can safely tolerate it. The reasoning behind this approach is that keeping pressure lower can reduce the long-term workload on the heart and blood vessels. However, other prominent medical groups advocate for a more relaxed target in older populations, suggesting that a systolic pressure of under 140 is perfectly acceptable and often safer for individuals over the age of 65. Why is there a difference in opinion? Because targets must vary based on an individual's complete medical profile. A person living with diabetes or chronic kidney disease has a different risk profile and may require tighter control to protect vulnerable organs. On the other hand, someone with a history of severe cardiovascular disease or someone who experiences debilitating side effects from blood pressure medications might require a more flexible target. It is a delicate balancing act where the ideal number is determined by your personal health history, not just a standard chart on a wall. There is no denying that blood pressure that remains too high over a long period poses a serious threat to your health. When your systolic number consistently stays elevated, it acts like a constant high pressure power washer inside your delicate circulatory system. Over the course of years, this excessive force creates microscopic tears in the inner lining of your arteries. These tiny injured areas become the perfect breeding ground for cholesterol and plaque to accumulate, which narrows the vessels and restricts blood flow. This cumulative damage is the primary driver behind major cardiovascular events like ischemic strokes and heart attacks. Furthermore, the heart is a muscle, and when it is forced to pump against high pressure day after day, it has to work much harder. Over time, the muscle walls of the heart can thicken and become stiff, a condition that can eventually progress to heart failure. High blood pressure also damages the microvasculature, the tiny, fragile blood vessels that feed your kidneys and your brain. When these tiny vessels are compromised, it can lead to chronic kidney disease. In the brain, this silent, long-term vascular damage can lead to microstrokes that you might not even feel, gradually contributing to vascular cognitive decline and significantly increasing the risk of developing dementia later in life. This damage accumulates slowly and quietly, often without a single warning symptom, which is why monitoring it is so vital. While the dangers of high blood pressure are widely publicized, the hidden dangers of blood pressure that is too low are frequently overlooked, especially in older adults. When blood pressure is driven down too aggressively, whether through over-medication or natural physiological shifts, the body can struggle to pump enough blood upward against gravity to reach the brain. This results in a sudden drop in perfusion, meaning your vital organs are not receiving the optimal amount of oxygenated blood they need to function efficiently. The immediate practical consequence of this is dizziness, lightheadedness, and a feeling of unsteadiness when you stand up from a chair or get out of bed. This phenomenon is known as orthostatic hypotension, and it is a leading cause of dangerous falls among seniors. A single fall can result in fractures, head injuries, and a permanent loss of independence. Beyond the risk of falling, blood pressure that is too low can leave you feeling chronically fatigued, physically weak, and mentally foggy. It can even compromise blood flow to the kidneys, paradoxically causing organ stress similar to high pressure. For an older individual, maintaining enough pressure to ensure that blood successfully reaches the brain and vital organs is absolutely essential for daily safety and cognitive clarity. Aggressively pushing numbers down to meet a youthful standard can sometimes cause far more immediate harm than good. This brings us to the concept of the blood pressure sweet spot. Modern medicine is moving away from rigid, dogmatic thresholds and shifting toward a philosophy of individualized care. For many older adults, The ideal blood pressure is not a rigid 120 over 80, but rather a balanced range where the cardiovascular risks are minimized and the patient's daily functional health is maximized. This means finding a number where your heart and arteries are protected from excessive wear and tear, but you remain entirely free from symptoms like dizziness, fatigue, or weakness. Many leading cardiologists now focus as much on how a patient feels as they do on the digital readout of the machine. If an individual has a blood pressure of 135 over 82, feels energetic, walks daily, possesses excellent cognitive clarity, and experiences no dizziness, that may very well be their personal sweet spot. Forcing that individual onto higher doses of medication just to force the number down to 120 could trigger side effects that ruin their quality of life and increase their fall risk. True cardiovascular health is about finding the optimal equilibrium between long-term risk reduction and short-term physical vitality. Achieving an accurate understanding of your blood pressure requires getting precise readings, yet many people inadvertently make significant mistakes when measuring their pressure at home or even at the doctor's office. One of the most common errors is taking a reading immediately after walking around, rushing into an appointment, or moving active items. Your cardiovascular system reacts instantly to physical exertion. If you do not sit quietly in a chair with your back supported for at least 5 full minutes before pressing the start button, your reading will likely be artificially elevated. Another frequent mistake is talking during the measurement. Even a casual conversation can raise your systolic pressure by several points. The position of your body matters immensely. If your legs are crossed at the knees or ankles, or if your arm is dangling down by your side rather than resting comfortably at heart level on a table, the mechanics of your blood flow are altered, leading to an inaccurate result. Furthermore, using the wrong cuff size is incredibly common. If a blood pressure cuff is too small for your arm, it will mistake the resistance and give a falsely high reading, whereas a cuff that is too large can provide a falsely low reading. Finally, external factors like consuming caffeine or nicotine within 30 minutes of a test, experiencing acute emotional stress, or encountering white coat hypertension, where the anxiety of being in a medical environment causes your pressure to spike temporarily, can distort the reality of your baseline health. To truly understand your cardiovascular pattern, you must also realize that blood pressure is not a static number that stays constant throughout the day. It follows a natural 24-hour internal biological clock known as a circadian rhythm. In a healthy cardiovascular system, blood pressure is typically at its lowest while you are asleep during the night, a phenomenon doctors refer to as nighttime dipping. As your body prepares to wake up, your system releases a natural surge of hormones like cortisol and adrenaline. This causes a normal physiological rise in blood pressure during the early morning hours, often referred to as the morning surge. Because of this constant fluctuation, a single isolated reading taken at one specific moment in time tells us very little about your true health status. If you only measure your blood pressure once a month at a doctor's office after fighting traffic, you are looking at a single pixel of a very large picture. This is why many clinicians recommend tracking your numbers at home over the course of a week, taking one reading in the morning before breakfast and medication, and another reading in the evening before bed. This approach reveals your true average baseline and shows whether your body is properly transitioning through its natural daily highs and lows. Fortunately, managing your blood pressure and supporting vascular elasticity does not rely solely on prescriptions. There are highly effective, evidence-based lifestyle practices that older adults can integrate into their daily routines to naturally encourage a healthy pressure range. Regular physical activity remains one of the most powerful tools available. Engaging in a brisk daily walk for 30 minutes helps stimulate the release of nitric oxide in your blood vessels, a natural compound that signals the smooth muscles in your arterial walls to relax and widen. Resistance training, using light weights or resistance bands twice a week, further supports vascular health by improving muscle mass and overall metabolic efficiency. Dietary choices play an equally critical role. While reducing excess sodium from ultra-processed and packaged foods is beneficial, ensuring an adequate intake of potassium-rich whole foods is often just as important. Potassium works as a natural counterbalance to sodium, helping the kidneys flush out excess fluid and directly relaxing the tension in blood vessel walls. Incorporating foods like leafy greens, sweet potatoes, avocados, and bananas can make a profound difference. Additionally, prioritizing high-quality, uninterrupted sleep for 7 to 8 hours a night gives your cardiovascular system the vital time it needs to drop into that low-pressure, restorative resting phase. Managing long-term stress through deep breathing exercises, staying consistently hydrated throughout the day, and maintaining a stable, healthy weight all work synergistically to alleviate unnecessary stress on your heart. While blood pressure is undeniably important, it is crucial to remember that it is only one piece of a much larger puzzle. To truly protect your longevity and vitality as an older adult, you must monitor several other key indicators of cardiovascular and metabolic health. Your resting heart rate, for example, provides deep insight into the efficiency of your heart muscle. A lower resting rate often indicates a stronger, more conditioned heart. Your waist circumference and blood sugar levels, including your fasting glucose and hemoglobin A1C, are critical metrics because insulin resistance and elevated blood sugar directly damage blood vessels and accelerate arterial stiffening. Your lipid profile, which includes your cholesterol ratios and triglycerides, helps evaluate the specific environment inside your arteries and the risk of plaque accumulation. Beyond these biological markers, functional measures of health are incredibly predictive of long-term wellness. Paying close attention to your sleep quality, your overall cardiorespiratory fitness, your physical balance, and your lower body muscle strength will tell you a tremendous amount about your true biological age. A person with slightly elevated blood pressure who possesses excellent balance, strong muscles, and great stamina is often in a much safer, healthier position than someone with a perfect 120/80 reading who is physically frail and prone to falling. When it comes to the human body, context is everything. There is no universal, perfect blood pressure number that applies to every older adult across the board. The human body changes as it journeys through time, and our medical goals must adapt to those changes. While keeping your blood pressure within a managed, stable range is essential for preventing long-term complications like stroke and heart disease, forcing your body to meet an arbitrary, youthful standard can sometimes introduce unnecessary risks to your safety, balance, and quality of life. Your personal blood pressure goal should always be an individualized decision, carefully determined in partnership with a trusted healthcare professional who looks at you as a whole person, not just a number on a chart. Consistency in your daily habits, accuracy in how you measure your numbers, and an ongoing focus on how you actually feel will always matter far more than obsessing over a single, isolated reading. Focus on nourishing your body with nutrient-dense foods, keeping your body moving every day, protecting your sleep, and managing your stress. By focusing on these fundamental pillars of health, you are not just managing a number on a monitor, you are actively investing in your long-term vitality, protecting your brain, and giving yourself the gift of a vibrant, independent, and healthy life.